I know the sign-up sheet is out there. If y'all will bring that up to Morgan, we'll need that and we'll get started. Thank you all for attending today, members and people in the audience. We're going to start today with House Bill 94, Representative Lumsden. That's an LC 520653. Go ahead. Yeah. See if that one's on. Yeah.
Yes.
Okay.
Yes. Mr. Chairman, members of the committee, I bring to you House Bill 94, which is a bill that will provide insurance coverage for costs associated with the harvesting and storage for up to 1 year of certain biological tissues necessary for future in vitro fertilization for those individuals who have been diagnosed with cancer, lupus, or sickle cell. As you may know, the treatment for those who have such a diagnosis usually involves treatment such as radiation or chemotherapy, which renders the patient infertile. This bill does not cover the cost of in vitro fertilization. It only addresses the cost of harvesting and storage of the biological materials necessary for future in vitro fertilization for those individuals who have been so diagnosed. Mr. Chairman, that's all the bill does. It's very short, very to the point. I believe there are a number of people here who are in support, and I'll be glad to answer any questions that the committee might have, but I know that there are some here who would like to speak in favor of the bill.
I got lights.
Yeah.
Is it-
Thank you, Mr.
Yep,
Chairman.
okay.
Perhaps you, Mr. Chairman, are the perfect person to answer this question. What does the insurance industry think about this particular bill?
Well, we have some representatives here. I think they will be glad to make some statements regarding that. Point being, they're okay with it. The second point being, we're talking a very small universe of people here. When you consider everybody that's insured, this is a very small universe of people in their reproductive years who might find themselves with this. So has a very small impact as far as insurance is concerned. But I think if you would put yourself in their position at that time in their life, realizing that you're dealing with one of these types of diagnoses, then the reality of being able to have children comes into play. And this just provides them a bit of a lifeline, I guess, in a very difficult time.
Thank you, Mr. Chairman.
Representative Mathiak.
Thank you, Mr. Chairman. Thank you for this bill. I know it's a good bill. How did you come up with the list of cancer, sickle cell, and lupus? I get a little nervous when we just kind of narrow it down to a few syndromes or illnesses.
This came to me from the folks over at Emory, and this was the request that they made in regard to, I guess, the type of situations that they find where people may be put in this position.
Gotcha. Thank you.
Representative Clark.
Thank you, Mr. Chair. My first question, you actually alluded to it when you were talking about the bill. You said it's only going to apply to a small number of people based on those during reproductive years. And I noticed on line 44 of the bill, it does say that the insurance company can have age restrictions. Given that people, the definition of reproductive years might be shifting a bit, and there are people who are having babies later in life. Do you have any idea of what reproductive age means for this particular bill?
That really falls under the insurance commissioner's office. They are generally the ones that establish criteria of that type when they're dealing with these things.
All right, and then can I just a follow-up question? To follow up on Representative Mathiak's question, I noticed that it chose 3 diseases. Is there a reason why it doesn't just say anyone who has to undergo any treatment that might render them infertile versus choosing these 3 as a diagnosis?
I'm by no means a expert in the area of reproductive health. I think we do have some people from the medical world that are here in support of this that might be able to address that more directly for you. But based on my understanding, these are the three diagnoses where you see the majority of the situations occur where the where the treatment occurs and the reproductive capabilities are impaired.
All right, thank you.
Thank you, Mr. Chairman. Let's go ahead and hear from our list here of people wanting to address the issue. Jennifer Kawas. Probably not pronouncing that right. I apologize. Yep, if you could go to that same mic, yeah. Could you state your name and where you're from?
Sure. My name is Jennifer Kawas. I am a reproductive endocrinologist that works at Emory. I'm here representing myself as a private citizen. I'm also part of the Georgia Fertility Network.
Okay, go ahead.
So I am here in strong support of this bill. I see patients on a regular basis that come to our clinic after a devastating cancer diagnosis. These are often young women that have not yet had an opportunity to build their families, and they are in a position where they have to make a very quick decision about whether or not they can move forward with freezing eggs. They can also be actually young men freezing sperm in the hopes of having a chance at building a family after they're done with their cancer treatment. I can say that it is incredibly devastating when the decision comes down to cost and finances, and there are individuals that very, very clearly want nothing more than to have the hope of building a family in the future. And when the reason that they have to decline treatment is related to cost, it's truly heartbreaking. I can also add a little bit of a personal story. I myself was diagnosed with breast cancer at age 40. I was lucky enough to have had my children, but I can say as a survivor of breast cancer that if I had not had the opportunity to have children before my chemo, which did make me postmenopausal, it would have been, that worse than any cancer diagnosis would be, not having the opportunity to be a mom. So I'm happy to answer any medical questions or personal ones.
You have done. Good job. Okay, up next, Alexia. Zach French?
And Alexander.
Is that mine close? Oh, these people.
Yeah.
Scooch over here.
Hi, my name's Alexandra French.
I'm Zach French. I'm her husband.
Oh, okay.
I'm here today talking as a breast cancer survivor. So I'll tell you a little bit about my story. I was diagnosed at the age of 31 with breast cancer. No family history. I was young. I was healthy. I found a lump, went into the doctor. From the day that I was diagnosed with stage 3 breast cancer until the day that I started chemo was 3 weeks. A lot happened in those 3 weeks. I saw several doctors. When I met with a fertility specialist, I was fortunate enough to have my eggs retrieved. But as Dr. Kwasa said, there's nothing more painful than hearing that you have cancer. But to also be able to told that you may not be able to have a family is another gut punch. That's something that cancer takes away from you, and it's something that just keeps on taking away from you time and time again. So I'm fully in support of this bill.
Grab that. All right. I'm just going to add one thing. I think a lot of people in here would agree that family is probably one of the most important things out there. And we were fortunate enough to have one child naturally before Alexandra's diagnosis with breast cancer, but we definitely weren't done. And without protection of fertility preservation, we wouldn't have had the opportunity to continue to grow our family. So we hope that you'll consider this bill and approve it.
Thank you. Thank you.
Thanks.
Any questions? Seeing none, thank you all very much.
Thanks.
Brooke Shera. Is that Brooke or Brody? Sorry, Brody. It is Brooke. Okay, well,
Hi, I'm
reading your print.
I'm Brooke Shervin. Thank you for letting me come today. I'm a oncology nurse, a researcher. I focus on fertility-related care for young children, adolescents, young adults with cancer, and I'm very passionate about fertility preservation from my experience in my role. I'm here as an individual, not representing my institution.
Any questions? Thank you very much. I appreciate it. Oh, thank you very much. I appreciate it. Sorry. Okay. Jesse Wethington.
Good afternoon. Thank you, Mr. Chairman, members of the committee. I'm Jesse Wethington. I'm the president of the Georgia Association of Health Plans. I don't have any specific comments on the legislation, but just wanted to say that my members don't have any concerns with this bill. We appreciate the chairman and the advocates on the other side working with us. And that's kind of all we had to say about that. So
We all
can't commend this
appreciate
bill to y'all.
that. Thank you, Jesse.
Thank you, Chairman.
All right. Anyone else wishing to speak to it?
Yeah, Lynn Goldman with Georgia Fertility Network would just like to make one more comment and support briefly.
Sure. I'm Lynn Goldman, and I am the president of the Georgia Fertility Network. I'm also, thank you, I'm also a fertility attorney as well, and I'm also a mom of twins from IVF myself. And we are very much, we as Georgia Fertility Network are very much in favor of this bill. I do want to address the question of why weren't more diseases involved in this bill? If we could have more, we would love to have more. I will tell you, one of the reasons that sickle cell was included in the bill is because Georgia has one of the highest rates of sickle cell in the country. So that was really important for us to have in there.
Okay. Any questions? Thank you very much. All right, that's got everyone wanting to speak to the subject. Do I hear a motion?
It passed, Mr. Chairman.
Do I hear a second? Okay. All those in favor?
Aye.
All those opposed? Hearing none, Mr. Chairman, you have your House Bill 94 do pass, LC 520653. Correct?
Thank you, Mr. Chairman.
Thank you.
Members of the committee, greatly appreciate it.
Thank you. Okay, up next is House Bill 87, Representative Clark. This is a hearing only. We still don't have a fiscal note on this bill. Representative Clark here? Yeah, there he is. Okay.
Thank you, Chairman and colleagues, for hearing this bill. Hearing only, but next time, hopefully, we'll vote it out of committee. With me, I have Rachel Foyer here with me to help answer any questions, and she's very passionate about this subject. Just wanted to acknowledge we seem to be at a disadvantage here in this committee. Most of us have not had firsthand experience with prosthetics and orthotics, and today I aim to level the playing field and give a summary of House Bill 87, as well as introduce you to Georgians living with limb loss and limb indifference. The first major question you may all be asking is, how does this change current Georgia code? And House Bill 87 aims to change the definition of medical necessity deemed by law for orthotics and prosthetics. Currently on the Georgia law and common criterion, commercial payers, prosthetics, and orthotics used for specific activities such as, but not limited to, toileting, showering, playing on a playground, participating in adaptive sports, running, biking, are not covered or eligible for coverage currently. Did you know that if a licensed prosthesis or orthotist mentions in his or her note anything concerning specific activity, that the device will help the patient it will be denied by insurance currently right now. And House Bill 87 will allow medical necessities to include showering and bathing. Wildly, those activities of daily living are not covered by insurance. The three guiding principles of our change in medical necessity are, on the physician's recommendation, licensed prosthesis and orthotist licensed CPOs are required by law to treat according to the orders of a treating physician. A doctor of medicine licensed to practice medicine or surgery in this chapter, in the state under Chapter 34 of Title 43. On the needs of this individually, the specific needs of each individual must be carefully assessed by the licensed CPO and treating physician to determine the most appropriate orthotic or prosthetic device. The need of an additional orthotic or prosthetic device is determined based on individuals' personal goals, desires, and needs, which only improve the total quality of life. And then the functional outcome, a licensed CPO will focus on how the orthotic or prosthetic device will improve the individual's ability to safely function in their daily life and participate in society. And then today, one second, I brought a handicap parking sign. So we see these a lot when you pull up to go shopping, and then you see it on license plates and all that. Let this sign serve as a reminder of the people we aim to bring into the fold of society. Each time you see these signs, please stop and consider the people chosen to live in this day and time in a society not designed specifically for them. Maybe pause to think about the curbs, the handrails, the doors, and steps these individuals have to consider every time they leave the house, even more in their own homes. And what we're asking for is a pathway to coverage when medically appropriate and necessary. So, I mean, I think a big thing that hit me, I know last week, Capitol Day, we brought down a lot of individuals, and I recognized them in the House chamber. And one of the stories that hit me, meeting a lot of the individuals, and you're here from a few today, one of them, this young woman, she attends UGA right now. I think it was in 2017, she told me she had lost one of her legs, and she came up to me and she was like, "Hey, thank you so much for carrying this bill." And she's like, "I just ran for the first time since 2017." And she's like, "Can I show you my video?" I was like, "Yeah, definitely." And it was her on the track, running for the first time. And then she said to me, she goes, running was amazing, haven't since 2017. She goes, "But my biggest dream and dream for life is to be a mother and be able to take care of my kids, play with them, run around." So anyways, it just hit me a lot harder. It's like, I'm a dad. I can imagine not being able to chase after them, play hide and seek in the house, outside, chase them around the playground, play tag. So I think it's easy until you dig into this even more. When you hear these stories, and you're like, wow, what if that was me missing a limb? And I know one thing, thankfully it never happened, but I remember even in the military, I was thinking like, overseas, every time I go to the wire, the number one thing I prayed, because physical activity is huge to me. It's how I clear my head. It's great for mental health. I mean, there's no drug in the world that's more powerful than going out for a run. Lifting weights is great, but the run is just, when you get done with that, it just clears your head, makes you feel better, and it's huge for health. So I know that never happened to me or my three other brothers who were all deployed. But that was always in the back of my mind, was like, I come home, I'm missing a limb. I can't go run, exercise. And we talk a lot, and we've done a lot in this house chamber, of mental health and helping people out. I think this group right here of Georgians, it's even bigger. If they can't get out there, they only get, this is bill, currently in law, you only get one prosthesis, every 3 to 5, is it 3 to 5 years?
3 years.
3 years.
For orthosis.
And with that one, you can't go run. You're usually not being able to shower it because you have to take care of that one prosthesis because if you damage it, hurt it, you're liable, and it's going to be a lot tougher to live life. And even, I think we brought the bucket.
Yes, I have it for you.
I heard, actually multiple people, but one story I heard talking to one man was he was traveling on business and he couldn't shower with the one prosthesis that he has, and he has to use this chair he unfolds, he packs in a suitcase to take a shower. It breaks. So he has to get his prosthesis, put it back on. He had to go to a Home Depot, pick up the bucket, come back to take a shower. And so it's just making me even more passionate of why we need to pass this bill, and I think it would go a long way just in the physical, mental health of the state. I can go way more into details, but that covers what this bill does, and I'm open to any questions or what do you want to hear more.
Push your button. Representative Bennett, you on 6? Okay.
Thank you, Mr. Chairman. You mentioned currently a person is only eligible for prosthesis every 3 years. Will this change the frequency? I know it will allow for certain activities, but will it change the frequency?
This would allow for an additional, because right now the standard, you're not able to go out like the story I told about that young woman, going on the track and being able to go run. So you need an additional prosthesis to be able to go run, or if you wanted to get in the shower, take a shower and feel human, and stand there and shower, not have to sit on a bucket or a chair.
Mr. Chairman.
Yeah.
So will that prosthesis also be limited to one every 3 years is my question. Every 3 years.
Yeah.
Okay, thank you so much.
Representative Schofield.
Yeah, thank you. Well, it's good to see everybody. You know how I feel about this. When you came to my office last year, earlier, we started this journey together. And so hearing from the limb loss community and being able to tour the lab where they make them and being able to come to your fair gave me a different perspective of the value of life that we take for granted. And so I just thank you again for introducing me to this community, which I now call family. And all of the people and all of your efforts and the work that we did together has gotten us here. So I want to just say thank you. And thank you, David, for stepping up and recognizing we do need to pass this bill. We need this.
Okay, thank you. Representative Clark.
Yes, thank you, Mr. Chair. So this seems to me like something that should not be controversial or difficult to do. So I'm just really curious, how do the insurance companies feel about this? And what is the opposing argument to not provide this type of coverage for people who could really benefit from this type of coverage?
Well, that's one thing that passed to you.
Yes, please.
I mean, it shouldn't be controversial. When you think about the mental and physical health, you need an additional prosthesis to be able to shower, to go exercise and all that. You guys have something to say?
Let me introduce myself. My name is Rachel Oyer, and I am a private business owner with my husband in Hall County, Georgia. I own Alliance Prosthetics and Orthotics. I am not a CPO, so I am not actually able to treat you. However, I am able to verify your insurance. So one of the things that I would say as opposition stands is wondering how are we going to cover the cost? And I think that would be the conversation that I'm prepared to have and willing to answer those questions. Really hopeful that the opposition that we might have would be so willing to have collaborative conversations of how we can find compromise, because what stands between the two of us is patience. So on one side, I believe prosthetics and orthotics changes lives. I don't think that the insurance companies don't think it changes lives, but who's caught in the middle are patients, and those are people. And I'm so eager for you to hear from those that live here in the state of Georgia, living with limb loss and limb difference.
Okay. All right, seeing no more questions, we have a few people who would like to speak to the bill also. Susie Barrett.
Hi, I'm Susie Barrett. This is my son, Elliot. I'm just a mom, and Elliot's just a kid. And he was born without his right leg. We did not know about it. He's a twin. We were diagnosed with something called twin-to-twin transfusion syndrome. He's a miracle to even have made it full term. So he has not known anything different. At 9 months old, he wasn't going to be left behind. He started to crawl, and he got his first prosthesis. And that's when we started to go max out of pocket every single year for our insurance. Now, we're grateful to God. We have great insurance, and that has paid for a very large portion. But we have a lot of friends that we meet every year or on meetups that don't have the same insurance as we do. They're on constant payment plans to pay off devices. Some of these children, or some of our friends, have 2 leg losses. So we're talking about a small population, but it means so much. For them to go out and play, he's not going to be left behind. I've been told that maybe baseball is next, but he was outside running on the side of the Capitol racing me. And this leg is not a racing leg. They're boundless with energy, as most parents or grandparents know. And he's not going to be stopped. But this leg is probably going to give us another few months, and then we're going to have to get something new because he grows so quickly. We also are fortunate to live in the metro Atlanta area. A lot of our friends don't. They live in very rural parts of either Alabama or Georgia, and this is the closest area they can get to in order to get some kind of support and need. I was just in Jackson this weekend, and I ran into a man who was supposed to be here with us, and we were talking about both that he has a limb loss as well, and we were talking in the middle of this hotel lobby, and he said, man, I really was just talking this morning how I would have loved to have a leg so I could shower with, because he can't in these ADA compliant rooms, which are not, always ADA compliant, y'all. And and I thought the bucket is another story. Just having another device. It's not to scale mountains. It's just to live and live with respect and dignity. And I want that for my son for the future. He won't always be on my insurance plan. Thank you.
Thank you. You do have a couple questions. Representative Mitchell.
Thank you, Mr. Chairman. It's a shame that the rural areas of the state don't have a solution to that. But I tell you, I have heard enough, Mr. Chairman. I move due pass.
We got a few more people who want to speak, but thank you. You're out of order, as usual. Representative Kelly.
Thank you, Mr. Chairman. Elliot, I just want to know, are you enjoying this more than being at school today?
Yes.
All right. Good answer.
All right, thank you very much.
Thank you so much.
Brad O'Malley. I don't have a tough time reading it.
My name is Brad O'Malley. My wife, Nani, and I live in District 108, where we raised our son, Brendan, who currently attends Georgia Southern University studying paleontology. I also run a small woodworking business out of our house. In 2018, I developed a type 2 bacterial infection that led to sepsis, meningitis, and paralysis in my lower legs. Now I wear orthotic braces on my left and right lower limbs to walk. I'm a very active person with my wife and son, and I enjoy creating music, walking, mountain biking, and boxing. I also take care of our dogs and yard while working on projects around our house. Through my recovery and rehabilitation, I found a lot of confidence in challenging myself physically. This led me to having broken many orthotic iterations because they were not strong enough to endure my desire to push the limits of my physical activity. Despite the orthotics being broken, insurance repeatedly denied their coverage and ultimately denied me the ability to move. Currently, I wear very heavy-duty braces, which you may have seen me have on when I walked up here, to withstand my physical activity. which I paid for out of my own pocket because insurance would not cover them. But HB 87 would allow me to have a lighter, more everyday appropriate device, as well as a heavy-duty physical activity device covered by insurance. This would be life-changing for me and would allow me to successfully continue to run my small business, allow me to continue to achieve my physical goals, and to serve my family as a father and husband. Thank you.
I want to thank you for coming and speaking today. You do have a question, but I just want to make a comment. I appreciate you coming, speaking today to the orthotic portion of this bill. It's very important also. Who do we have? Representative Clark.
Yes, thank you so much for your story today. You mentioned that you're having to pay out of pocket. Could you kind of give us some context as to like what those types of costs look like? Because I don't think a lot of us know.
So these orthotics, I'm going to stand up so everybody can see these. These particular devices were approximately $3,000 each.
What?
Yes, $3,000.
Oh, 3,000
Each. Oh my goodness. All right. Thank you so much for that context. I think that's really important for the members of the committee to understand.
Good point. Okay, thank you very much. I appreciate it.
Thank you guys.
How about Brandon Todd?
Hello, I'm Brandon Todd, and I'm a patient advocate, and I'm supporting this bill to the fullest. And this because about 6 years ago, when I woke up, I went for a run about 5 to 7 miles. And on later that day, I was trying to help another motorcycle rider because I was driving my motorcycle down 85 South. And I was struck from behind and drugged. And this was March the 17th, 2019. And about a week later after that incident, I was told I was going to be losing my leg. The first thing I thought about was, would I be able to run again? And when I received my first prosthetic, and this has been the only prosthetic I've had up until recently, I went through a lot of loopholes, searching for a lot of nonprofit organizations to donate me a blade because running was something that really just allowed me to clear my mind. And if I was ever feeling down mentally, I know I could go for a run and I'd be recover from everything. It's therapy to me. And when I wasn't allowed to receive this additional limb because it wasn't covered, this additional prosthetic because it wasn't covered through insurance, it left me in a dark place. And going through all of those loopholes, it took about probably 2 years before I actually was donated a limb. So probably within the last year. And so you can only imagine someone who's extremely active. I hike, I enjoy swimming, biking. I actually biked here, but doing all of these physical activities and knowing that there's so many people out in the world because I post what I do. As you know, we're in a digital world on social media, and everyone is always like, hey, can I do that? How can I get that? And I really don't have any answers for them because I know that insurance won't cover it. But with the bill HB 87 being put through, these individuals will now be able to get back to what I call a second chance and their therapy and out of that dark place, because everyone's mental health matters. So that's my story, real brief, and if anyone have any questions, feel free to ask.
It's a good story. Representative Petrie.
Yes, sir. Thank you, Mr. Chairman. No question. I just want to commend you. You know, we've got all this chronic disease in society. You're jogging, you're running, you're doing all these things, And what an inspiration that is. That's most of us that don't have any limitation or failing to do as much as we should be actively. So what a great inspiration you are, and I support you fully.
Thank you. Thank you.
Thank you. No more questions. Thank you.
Thank you all. You're welcome.
Up next, Gerald Wallace.
Thank you, committee, for your time and for giving us an opportunity to talk about House Bill 87 this morning, this afternoon. For the first 18 years of my life, I was sitting in a similar position as much as you all were waking up this morning. Now, not as a member of the House of Representatives and not serving on the Health Committee, but as a member of society who knew almost nothing about the prosthetics and orthotics industry and community. My senior year of high school, after signing to run track and field at the University of Georgia, I had to undergo a simple surgery due to an overuse injury I had been dealing with most of my career. Unfortunately, what should have been a 6-week active recovery turned into 2.5 hardest years of my life. After 10 reconstructive surgeries trying to save my leg and being in chronic pain every single day, I made the hardest decision I ever had to make: to electively have my leg amputated below the knee at 20 years old. With the hopes of being pain-free and the desire to get back to an active lifestyle, I focused heavily on my recovery journey. When it came time to get fitted for a prosthetic, all I wanted to do was to run again. That's when I found out that the insurance that my parents had as employees at the University of Georgia did not cover a secondary running prosthetic. Knowing that they were swamped with hospital bills that they had paid over the last 3 years, my dreams to ever run again was put on pause. But I was never one to take no for an answer. I knew that God had a bigger plan for my life, and it was time to start telling people what my goals were. I wanted to be the fastest amputee in the world, and I needed their help to get me there. Through financial support from members of my community, my prosthetic company, and a blade manufacturing company all coming together, we were able to find a way to get me my first running prosthetic. One thing that I learned during this time is that if you have a strong enough conviction about something that you want to accomplish, and a clear enough way to communicate that vision, then all you need is the right team to help you accomplish that goal. My goal then was clear: to be the fastest amputee in the world. And the right team came together to make that happen. I became a world record holder, not once, not twice, but 4 times and counting. I stand here before you today with a new conviction: to help amputees like myself gain access to the technology to pursue their own mobility dreams and goals. From playing with their friends in recess to taking a shower safely, and maybe even breaking some of my records. Together in Georgia, we have built an amazing team that has gotten us to where we are today. I'm grateful to the So Everybody Can Move Georgia team, our lobbyist, as well as Representative David Clark, and the conviction that he too has for this unified vision in the state of Georgia. Today, I stand before you asking you to join our team. Through the passing of this bill, thousands of amputees in Georgia can regain their hope, their purpose, and access to mobility on their terms. I hope that no one ever has to experience the pain of losing a limb. But the reality is, ourselves, our loved ones, and our friends are only one accident away from this becoming personal. So I leave you with one final question. If this bill does become personal, what would you want it to say for you? Thank you.
Any questions? Thank you. Good testimony.
Sir, thank you, guys.
Abigail Thompson from Shepherds.
Good afternoon. My name's Abigail Thompson Garcia, and I'm Director of Government Relations and Advocacy for the Shepherd Center. We are a 152-bed rehabilitative hospital based in Atlanta, and we specialize in the treatment and recovery of catastrophic injuries. So we do oftentimes treat patients who have experienced limb loss, and so part of our specialty rehabilitation is for amputees. So we are here to offer our full support for House Bill 87. From an organizational perspective, we're generally supportive of any measures that improve access to coverage, especially for specialty services such as this. And this will do a lot to help patients dealing with limb loss. At Shepherd Center, we think that you can turn just about anything into rehab, and so oftentimes this does require patients to have more than one device or prosthetic so that they can get back to doing the hobbies that they enjoy doing. So I know it's a hearing only, but we would ask for your favorable consideration of this bill, and I'm happy to answer any questions.
Any questions? No questions. Thank you very much.
Thank you.
And last, Jesse Wethington.
Me again. Again, Jesse Wethington, President and CEO of the Georgia Association of Health Plans. So wanted to call the committee's attention to one concern that my members did have with this bill. Not here to speak on the mandate language per se, and have shared our concerns with the bill sponsor and the advocates on the other side as well, but that relates to the issue of the treating physician's determination of medical necessity that appears at line 35 and 36, and then is referenced 3 more times throughout the bill. My members have requested that language be struck, and at that point I think we would not have an issue with House Bill 87 if those were to be accommodated. And the reason for that is there is no other part of a medical benefit that's sort of treated that way, where the treating physician is the sole determiner of medical necessity. This would put these sort of benefit classes kind of on a different footing with everything else. And nobody likes utilization review, but it is a pretty necessary part of what the role insurance companies play in terms of controlling fraud, waste, or abuse, or making sure that the device or orthotic or prosthetic truly is medically necessary for that patient. I also wanted to call the committee's attention to one other piece of the bill at line 79 and 80, subsection F, paragraph 1. As one element of the Affordable Care Act, any expansion of the essential benefits package beyond as what it existed in 2013 can potentially have a state budgetary impact. That's happened in some states as recently as last year, so we just want the committee to be aware of that as well. But Mr. Chairman, members of the committee, that kind of highlights our issue with the bill, which is again narrowly focused on that one aspect of the definition of the treating physician and their determination of medical necessity.
Okay. So, in your opinion, then, what I'm hearing you say is when they include treating physician to be medically necessary, that removes the insurer from any decision in that area?
That's correct. So we believe this bill would pass as written. At that point, we would have no recourse and would have to pay, for whatever treatment modality was recommended by the attending at that point, with no ability to review.
Okay. Are there any questions? I will look forward to you and the author of the bill working through this. I think this is a very good bill and something needed. I think that can be overcome.
Yes, sir. And I spoke with the supporters and the author as well. I do believe we'll be able to arrive at a reasonable compromise that can kind of meet everybody's goals. So hopefully we'll do that.
Any questions from the committee? Okay. So like we said before, we're a hearing only today. We need to get a fiscal note on this, and I know that you have worked on that, and my office has been working on that for the last 2.5 weeks. So, okay, up next is House Bill 69. Oh, excuse me, House Resolution 69. Representative Barnes.
Thank you, Mr. Chairman, and thank you, committee members. Representative Imani Barnes. I'm here to try to pass House Resolution 69. It's to acknowledge Biomedical Research Day. I am a biomedical research scientist. I have been one for over 20 years. I do biomedical research at Emory University. So I am here to explain the importance of this day and the importance of what biomedical research does for our community. I understand the importance and contribution to helping people globally across generations. So pretty much biomedical research is the preclinical studies that put in place a lot of the orthotics and the therapies that were discussed earlier in several other bills. So it combines various sciences and disciplines, including biology and genetics and pharmacology, to advance medical treatments and cures and medicines. So House Resolution 69 proposes recognizing Biomedical Research Day every third Thursday in April to increase awareness of what biomedical research brings to the medical field and the advancements that it benefits both humans and animals. This resolution would recognize the efforts of biomedical research technicians and scientists and veterinarians and the critical role they have in advancing research. It encourages initiatives that promote understanding of the contributions of this research and aims to foster a community that supports scientific research. So House Resolution 69 will just acknowledge biomedical research as a day, and so we are more aware of what we bring to this field.
Thank you, Mr. Chair. Thank you to my colleague and in multiple ways, and also to a woman after my own heart when it comes to the importance of biomedical research, science in general. I just want to thank you so much for bringing to light the contributions of biomedical researchers and how much they contribute to our society in general. And I look forward to hopefully being able to get more people in Georgia to understand exactly what biomedical researchers do and why they're so important to Georgia, especially with us being a state with so many research institutions.
Thank you. I appreciate that.
Representative Kelly. Oh, Representative Bennett.
Thank you, Mr. Chairman. And without having to repeat what Dr. Clark said, I too think that this is a most appropriate bill, very good timing, and all that is being done in the world of science. And to increase his awareness and the need and use for it, I think is a wonderful opportunity for us as Georgians. And so, Mr. Chairman, when the appropriate time, I'd like to move.
Okay, thank you.
Thank you.
Any more questions? Appropriate time.
I move to pass House Resolution 69.
Second. All those in favor?
Aye.
All those opposed? Congratulations.
Thank you,
have your
Mr.
bill.
Chairman. Thank you, committee.
Thank
I
you.
appreciate that.
Okay, we've got presentations, and we also have a HR, which HR 117. It's not printed, so we're going to go out of order here. Let's hear from the hemophilia of Georgia first. And we'll see if we can get a print on this HR and go ahead and do that today, too. Go ahead, the floor is yours.
Thank you so much. I appreciate it. I apologize, everyone, if you have trouble hearing me today. I'm a little under the weather, but it's good to see you all again. You know what? I gave fair warning, I think. So I'm here just to share a little bit about our organization. My name is Michelle Condi. I'm our Senior Director of Advocacy. I am also a sibling and a child of someone with a bleeding disorder, as well as a carrier myself. If you're not familiar with who we are, we have been a part of the Georgia community for over 50 years now. We started as a small nonprofit organization with the main goal of distributing Factor to patients who couldn't afford it, who didn't have access to it previously. And so we exist so that people affected by bleeding disorders can live as normally and productively as possible. If you're not familiar with hemophilia specifically, it's a genetic bleeding disorder. It affects about 33,000 Americans, and we have just in Georgia 2,000 patients that Hemophilia of Georgia personally treats. So this can affect males, females, and predominantly it's present in males, and so we make sure that we're looking out for everyone who may be affected. A little bit about the work that we do and the way that we're able to do it. Hemophilia of Georgia is a participant in the 340B program, if you are familiar with it. If not, I'm happy to answer any additional questions about it because it would take much longer than the few minutes I have today with you. We're a covered entity, so any money that comes in through our pharmacy we use in order to give back to our patients, whether that means paying for their medication, paying for their insurance deductibles, any copays they might have, for their infusion supplies, things of that nature. A person that has something like hemophilia, their typical cost of care is anywhere between $300,000 and $500,000 per year. And that is a healthy year with no incidents, such as regular maintenance. If there is any incident, it's upwards of $1 million per year. Sometimes a hospital visit itself can be $1 million just there. So nobody can afford to have this, and so that's where we step in and we make sure that we're able to assist our patients and their families so that they don't have any further issues. We also offer comprehensive care with Georgia's hemophilia treatment centers, of which there are 5 in the state, and they're scattered all over. We also have nurses and social workers that do everything around the state to make sure that our patients are seen and their needs are taken care of. These are some of the programs and services and community events that we host. We have community fundraising, the HTCs, outreach nursing, outreach social workers. So our social workers and our nurses, each of the 2,000 patients that we have are each assigned a social worker and a nurse who visit them regularly at least once per quarter. They get an in-home visit and they have check-ins with them as well, and assisting them with insurance, assisting them with making sure that they're enrolled in some kind of program, they can afford it, as well as signing them up for any additional programs that they need assistance on. We have family programs, research, and our own advocacy days that we have with our folks here and in DC. One of the programs that we use to be able to support our patients is our CAP, which is the Client Assistance Program. So this is for insured patients, and so we help with deductibles, any co-payments, and patients have to be 500% over the federal poverty line or higher to receive that. We also have our IPAP program, which is the Insurance Premium Assistance Program. And so for that one, this is for any uninsured patient that we might have, and anyone between 133 to 500% of the federal poverty line is eligible for that. We also offer assistance, emergency assistance for a lot of our patients, so any kind of needs-based hardship, because as you can imagine, somebody with this kind of chronic condition in their life, they're facing a lot of high cost when it comes to their medical care as well as everyday life. So anything ranging from their rent, their mortgage, dental care, any kind of additional safety supplies that they might need, educational success. We also offer mental health, wellness, period poverty, and medical alert supplies. Basically, if our patient needs it, we'll review and make sure that we're able to accommodate any needs they might have. Part of this assistance comes from the Department of Public Health. We receive about $400,000 per year, and we're able to use that assistance for health insurance premiums, deductibles, and anyone that's eligible, 133% under the federal poverty line is able to take part in that. And so our social workers really distribute that and make sure that our patients are able to access any of that help. As I mentioned, we have 5 different HTCs in Georgia. They're in Atlanta, Augusta, and Savannah. Those are the 3 listed there. However, we also have 2 hybrid telehealth sites in Savannah and in Perry. As you can see in these pictures, we've had some legislative visitors there as well. We've been very lucky to be able to share the work that we're doing in these locations. The biggest difference for us has been that this program started in 2021. We had over 200 patients that had not been seen for years, and they're suddenly back in the fold. There are folks that, they haven't been able to come to Atlanta to be able to go to the big hospitals where they needed to be seen to get that full comprehensive care, and now they're back. There's folks that, we have one young man who went 22 years without being seen by an HTC, and so he completely disabled now. His joints have been destroyed. He had millions of dollars in hospital debt that had fallen to the state because he hadn't been able to get any sort of treatment in all this time, because it was either childcare, it was work, it was things he couldn't take the day to make his way to Atlanta, and he didn't have the transportation that he needed to make it there. So now our new telehealth clinics are making sure that our folks are taken care of wherever they might be, and if they can't make it to the hybrid center, we're able to take some of the technology that we have access to now and take it to them where they are. And again, we also have different programs that we use to connect our community. It's really rare to find somebody that has this rare condition. And so this is the best opportunity to connect. We have a lot of kids that come together, and it's the first time they're meeting someone that can't do the same things they can, but that they can participate in Camp Wanacla and one of these retreats where they go absolutely crazy If you've never seen a kid who's been told, no, you can't play soccer, suddenly told you can do whatever they want, it is like they've become feral, and it is a beautiful thing. They're surrounded by their nurses, their doctors, their social workers, the pharmacy techs, everyone there that's making sure that they get the assistance and the kind of care or treatment they may need in the moment. They also get mentorship from the older kids that have gone through this, that have been through these different stages, and they teach them how to self-infuse. So we've got 5-year-olds learning from 10-year-olds that are telling them, it's so easy, you just stick the needle in and it's over. And suddenly they have the confidence that they would have been crying about over with their parents for years and years. We also have family camp weekends, and those are fantastic. That was my first introduction to Hemophilia of Georgia on a personal note. When my family moved to Georgia, obviously terrified, not sure what we were facing, and this was my first introduction to HOG and the wonderful things they did, and it really was life-changing for myself and for my family. So HOG is also part of the Southeast Regional Hemophilia Network. We actually lead this network, and so it's 8 states that are part of it, and there are 26 HTCs that are part of that network, and that receive the funds for the 340B grants. HOG administers that. We offer technical assistance, and we're able to provide any help to the folks that are in these 26 HTCs. These are just some of our policy priorities, things that we're always on the lookout for, that we want to make sure that are bolstered, strong, and that we're able to make sure that our patients have access to. The 340B program, obviously, because it is like the lifeblood of what we do, not to be too punny. Telehealth and broadband, mental health, gene therapy is a new bigger thing that's coming up in our community, network advocacy, and health equity. And just last point, we also have the Hemophilia Advisory Board, which was created in 2011. This meets quarterly. We've got 14 folks on this committee, and they are folks that worked for the HTCs, people with hemophilia, people with different bleeding disorders, caregivers of people with bleeding disorders, and different advocates. And through this board, we provide updates to the Governor's Office of Health Strategy and Coordination every year. If you have any questions, I'm happy to answer them. And if not, you can always contact me there.
Any questions? I want to thank you for this presentation. As a provider, I've had some experience with someone that has a problem with hemophilia, although it was not a severe problem until they started taking a load of aspirin before they come in, and we're doing some tissue surgery on them, and then find that we're in a predicament. So thank you very much. The education is very important. Thank you.
I appreciate all your time.
Okay. I stand corrected on the arts as medicine in Georgia. HR 117 still in the hopper, so there's no vote on that today, but Representative Schofield, would you like to speak to it?
Well, I'm going to sit here if you don't mind, because of the potential sickness.
Yeah.
But good afternoon, and members of the committee. Thank you, Mr. Chairman. Arts as medicine is a innovative way that I've looked at, and other states are doing this, to actually create an intervention where we're using the arts. And arts, we know as health, is a continuum when it comes to mental health, when it comes to health, addressing health disparities, things like chronic disease and Alzheimer's. So this has been around for a minute. But this new innovative concept is going to be shared with you today on how it would be such a blessing and a economic driver in the healthcare space for people that are living with all types of disease. So I brought some subject matter experts today that are going to share a little bit about arts as medicine in Georgia.
Okay. I didn't have a sign-up sheet for them, I don't believe, but go ahead and introduce yourself.
Absolutely. Thank you, Chairman and members of the Health Committee. My name is Eve Bird. I am the Director of the Mental Health Program at the Carter Center here in Atlanta. First of all, I want to start by thanking you all for your years of commitment to improving the mental health of our citizens in Georgia. A great lift has occurred and continues to be needed. We continue to need to pay attention. Because we're all very aware of the mental health and substance use crisis that we're in the midst of. Although much has been done and resources have been allocated, this is a cry for all hands on deck to employ all that we know that can impact the mental health and well-being of our population. promoting mental health and well-being for the entire population and for those experiencing a disorder. Health crisis is not only the health sector's responsibility. Under the visionary leadership of our late co-founder, Rosalind Carter, the Carter Center is even more committed to continue our work to improve policy that has been demonstrated to make citizens healthier and happier and more productive in the community. Some of these statistics you're well aware of, that a third of our adults in Georgia are experiencing depression and anxiety symptoms, putting them at great risk for a debilitating disorder. Our youth are being hit hard, and our average is much higher than the national average, with 1 in 4 to 5 children in Georgia having a diagnosable illness, with a small percentage getting treatment for a whole host of reasons that we won't go into today. Isolation for teens and older adults, an enormous problem. I will tell you personally, in the last 2 months, I have had 3 teen suicide attempts among friends and colleagues. I practiced for 17 years as a psychiatric mental health nurse practitioner, and we never had that reported rate of suicide attempts. So we can't become complacent. It remains a crisis. Although robust effort continues, and we have allocated resources, we especially need to pay attention to rural Georgia, ensure that we have providers, that our insurance pays for mental health, and indeed we need to enforce our House Bill 1013 parity legislation now. But we can not only focus on the specialty care of mental health providers. We must promote and employ all evidence-based interventions that will improve the population's mental health. We know by a recent study by Frontier Economics in the UK that investment in arts improves quality of life and improves medical outcomes and potentially can save over billions of dollars in healthcare costs. The evidence clearly points not just to a quality of life, but productivity at work as well. As the saying goes, healthy is wealthy in many ways. If you invest in the health and well-being of the population, the return on investment has economic as well as health benefits. Exposure to even low doses of arts has significantly improved the feelings of depression, anxiety, loneliness, and make us more productive, and the science shows that. We have a tool that is being underutilized with the intention we have available to really impact the health and well-being of the masses. I have seen it personally in programming across the state and nation, where a stop-in art workshop for college students decreased leaving of the college. I've seen examples of hospitals using creative arts to engage marginalized populations in the community. I've seen examples of clinicians and others using the arts to reduce effects of trauma on children. Organizations that elevate the art in nature, the studio, the theater, schools, the streets to bolster individuals' mental health and recovery from addiction. I encourage you to adopt Resolution 117 and read further in the one-pager that we're providing you today. Now more than ever, we need to not just accept but embrace innovative solutions to prevent mental health crises and effectively address the well-being while reducing the pressure on our overburdened health systems. It's a remarkable time to have evidence behind us to move forward a solution to advance health, particularly mental health, through the arts in Georgia. Many thanks to you all for considering arts as a truly doable and effective additional response to Georgia's mental health crisis. Thank you, Representative Schofield, for your leadership in this area, and to Marcel Foster with Performance Hypothesis. I'm going to turn it over to my colleague, Erin.
Good afternoon, everyone. My name is Erin Jones, and I'm the Senior Director of Sales and Audience Development at the Atlanta Symphony Orchestra. I've also been an active member of the ASO Chorus for the past 24 years, so I enjoy producing and engaging in the arts, both on and off stage. As mentioned, we're here to request your support for House Resolution 117 for a statewide Arts and Health Commission to advance the treatment of mental health through arts intervention. It's not news that engaging in the arts evokes emotion and that we all yearn for it in many forms, because more than 1 million people walk through the doors of the Woodruff Art Center every year. What we are finding through a myriad of research is that music, theater, and art don't just make you feel good. They are, in fact, good for you. There are substantial benefits of integrating arts into health strategies, including mental health management, stress reduction, and managing the loneliness epidemic. The need for intervention is dire, as Eve was mentioning, with Georgia's mental health ranked among the lowest in the country. Across the globe, studies have shown that engaging in the arts benefit not only your spirit, but your brain and body as well. Just listening to relaxing music lowers your cortisol levels by nearly 60%, which helps maintain your blood pressure, heart rate levels, reduces anxiety and stress. For the treatment of major depressive disorders, music therapy shows a 25% improvement in symptoms. Conventional medicine in the U.S. relies heavily on pharmaceutical approaches to treating chronic conditions, but art-based therapies can be just as effective in treatment or prevention. A new wave of primary care physicians are prescribing arts engagements to improve mental health in patients. For statewide initiatives, Massachusetts has launched Mass Cultural Council to promote arts-based interventions for stress and trauma. And Rhode Island Department of Public Health has developed a state arts and health plan that also integrates arts for healthcare strategies. And we all know that the U.S. military has been using music therapy to treat veterans with PTSD and depression since World War I, so this is not new. For the aging population, more and more work is being done with regard to degenerative cognitive function, such as dementia and Alzheimer's. Dementia patients who participate in music therapy sessions show improved cognitive functioning by almost 30%. We have all seen videos or heard stories about patients who might not know their family's names, but can sit at a piano and play Chopin from memory, or hear their favorite song from 1950s and suddenly come to life again with stories of their past. At the ASO, we are working with the Goizueta Alzheimer's Research Center to share music with their patients and caregivers. At the first concert, we had 50 patients attend, and just yesterday we had over 250. And the work towards evaluating the impact is already underway. In April of last year, the ASO hosted an event led by Dr. Sanjay Gupta and Renee Fleming to dive deeper into this evidence related to music and brain health, depression, PTSD, and other disorders. We heard case after case from leading researchers from Emory Healthcare, the World Health Organization, and the Wounded Warrior Project, who shared incredible tales of resilience, overall health improvements, and brain functioning. The documentation is vast, and we are just scratching the surface on what can be learned. As someone who was born at Northside Hospital and lived here all my life, I take pride in knowing that Atlanta actually really does influence everything. And I do believe that we can influence the intersection of arts and health to combat this mental health epidemic. I strongly urge your support with House Resolution 117 so we can truly lead the charge in this work. Thank you. Now I'll turn it over to Christopher Moses with the Alliance Theater.
Thanks, Erin. Thank you all for your time today to listen to how arts can be a potential solution. I want to focus on young people. I'm sure everyone in this room remembers when the Surgeon General made that proclamation in December 2021 that the mental health crisis among youth had reached the level of epidemic. Like all of you, I'm sure it just made us at the Alliance Theater pay deep attention to this. What was really interesting is that very month, a couple weeks earlier, we received the first results of a 7-year research study we did on the power of the field trip on a young person's development. We all knew deep in our soul that something transformative happens to a young person when they experience art, when they experience a story that can transport them, but there was no data in the field. So we worked with the University of Arkansas on this experimental study, and what the results showed was pretty staggering because every factor that the Surgeon General ticked off that was contributing to the mental health epidemic, the rise in behavioral infractions, a rise in isolation, in bitterness among young people, a rise in despair, which leads to the suicidal thoughts that Eve was talking about. All of these things were addressed by our study. The young people who were attending the symphony, going to see a theater performance, and going to the museum were not only outperforming their peers in standardized tests, which is wild, not something we even thought of, but our researcher, his hypothesis was that they were increasing their level of concentration. From being inspired, they left and got back on the bus and returned a different human being. They also were displaying increased levels of tolerance. They could tolerate multiple points of view on a topic, so that would address the isolation and bitterness that was roiling our young people. And most importantly, and the one I come back to time and time again, a young person who leaves the theater leaves with a greater sense of hope about their own future. So now that we know these things, it is unassailable that the arts can be a factor in addressing these issues. It is up to us to figure out how to scale that, how to scale these benefits so it's not only available for those who happen to live close to, say, the Woodruff Art Center or who happen to have the money to afford it. How do we make this a birthright? How do we figure out how to link arms with the medical community so that we can prescribe these experiences and have preventative health benefits instead of having to address it on the back end when it is too late? I'll end with one story that I think really epitomizes what I'm trying to talk about. We just happened to be hosting over 100 high school students the evening that terrible tragedy in Appalachia High School played out with the mass shooting. And these young people gathered here that day, traumatized because 30 miles north of them this scene unfolded. They weren't sure how to really deal with these issues, and we happened to be presenting a play that was dealing with someone grappling with their own mortality on the eve of their own assassination, and it allowed them a chance to talk about these issues, to see that story played out in a different way, which gave them, again, that sense of hope that maybe next time that is not going to happen. So I think it is imperative that we invest and at least kick the tires on this idea with this resolution to see how the arts can play a part in being the solution. And I agree with you, Aaron. Like, why not Georgia? This is fast becoming the creative capital of the South and maybe the country. Why don't we think about doing things in an innovative way that can have real benefits for all in our community?
Yeah. Sure. Which one is that?
Thank you, Chair. You know, I don't disagree with anything. I agree with everything that y'all said. Absolutely. But I do want to ask you this. How is it, though, that in this today, when, you know, any music in the world, as far as that art, is available on your phone or on your computer, any artwork just about probably is accessible by looking it up on Google or artificial intelligence or something like that. And in fact, I mean, there is no community. I mean, there may be. I'm not in every community in the state, but I would think almost every community in the state, there are churches or synagogues or some kind of a religious institution or non-religious institution, for that matter, that there are avenues for talking to people and getting some kind of counseling and things. How is it? And I don't disagree. I mean, I would support you, but what is it that could be done? I'm just not clear what can be done through something like this that is not the resources are not already there. I'm not saying that this isn't needed, but I'm just kind of I was sitting here thinking as you're saying there's everything. There are just so many resources, and it just seems like they're not. I mean, I guess they're not being used. I know what you're saying. I had a young man come to me wanting to know if the state of Georgia had a law that required that when somebody wanted to commit suicide, and they're very serious about it, when somebody wanted to commit suicide, if there was a law that required that there was somebody that could tell them the best way to do it, the best way to do it without causing, harm to themselves, some kind of harm, not killing themselves entirely, but having to suffer some kind of a long-term disability or brain damage or something after. I mean, and I know that young man was very serious about that. I know that the problem is there. And I agree that something needs to be done, and I agree with you. But I'm just asking you, what is it that we don't have in these communities and through social media and the resources on our phones and computers? I mean, I listen to music all the time. I can find anything I want to. So why is that?
Do you want to take the music one? I have an answer.
Yeah, well, what I find fascinating is, as we're saying all this, it kind of seems like common sense, right? Like, of course, these things are good for you. Of course, it lowers.
Could you speak
Oh, sure.
for the recording?
Sure. I think the question that you're asking is that it seems like these resources are everywhere, and it should be obvious that these would be beneficial for your health. But, we also know that walking and exercise and a plant-based diet is great for your health, but we don't all utilize it, but we do know it. It's everywhere. We know that going for a walk reduces stress. We know that eating well, helps with heart disease, right? But we're not all doing it. But everybody is aware that that is a solution. Not everybody is fully aware that arts engagement can have this profound effect. We're just now scratching the surface of this, which is why the Arts and Health Commission is important, because we can help spread that word. We can help people engage more often in the arts, because while music is here all the time, not everybody is listening to it. They might not be listening. They might not be going to the theater, even though it might be readily available. They don't understand that all of these health benefits actually do exist, and we're just learning that.
Can I say one thing? The other piece that I listen to records all the time. I have a huge record collection, but there's something very different about that shared experience when it's live and you're experiencing this with other people. And I think that's a big part of the results that we saw from the field trip study, was not only the experience of the art, but experiencing it in community. So I don't disagree with you. I think there are pockets of things happening all over the state, in churches, in community centers, in professional settings. I think it's about getting the word out that these things really do have the benefit that they have, and encouraging more people to participate.
Okay, thank you.
Well, I tell you, I start my day off every day from 7 to 8 listening to music while I read bills. I do that. Anybody that comes in my office sees the little speakers I've got, and I've done that since I was in dental school, listening to music and studying. And I can turn the music off when I got to think hard. I do that in my brain, and then when the reading's easy, I start hearing the music again. So I think it's very beneficial, and I appreciate y'all coming and speak to this. I look forward to more action, and thank you, Representative Schofield, for bringing this resolution. Seeing no more comments, I would like to thank the committee for your time today and the audience for your time. This committee is now finished. Thank you.
I guess.